All right. Well, so Dr. Jochebed, who goes by B, Ade-Oshifogun, is an associate professor of nursing, and she earned her PhD in nursing from the University of Illinois at Chicago and completed her master's degrees in nursing education and critical care at Governor State University in Illinois. So Dr. Ade-Oshifogun has over 35 years of clinical management and teaching experience across Africa, Europe, and the United States. Before joining NMSU in January 2023, she was the Advent Health Endowed Chair of Nursing at Andrews University in Michigan. So her research here at NMSU has really been focusing on assessing, well, actually her research in her career has focused on assessing educational environments and exploring immigrant intimate partner abuse and violence. And her current Emerging Scholars Project involves developing a culturally sensitive questionnaire to measure intimate partner violence risks among first-generation Latino immigrants in southern New Mexico. Please join me in.
Thank you for your time, and thank you for waiting to hear. Usually the last person is kind of, you're tired, you're about to go. Well, thank you for staying to listen to this. I want to first say that I am grateful to the Emerging Scholar funding that enabled me to do this, to start it off, because it's still going to be a long way before we can finish this. I'm also grateful to the School of Nursing, because there's so much involved in this that the seed fund would not carry through. So the School of Nursing was willing to jump in and give me some funds to continue. So I'm not the only one in this project. I have another faculty who is Dr. Judy Patterson. She is also involved in intimate partner violence and abuse research, and she joined with me to do this project. And we are training two graduate students, one from nursing and one from computer science. And their names are up there, and they have been very active within this project. So the background for this is from what Dr. Doig introduction. I have been moving from country to country, and so it's really an experience for me to see from different countries and their perspectives and what is happening to immigrants. And of course, I'm also an immigrant. So I identify not with intimate partner violence, but with some of the experiences that they are going through. And I started this work since 2013, and I've been working on different projects that involves immigrants as well as intimate partner abuse. We started with Africans, and now we are moving into Hispanics or Latinos, because this is where we are right now. So the risk is really high in this county. It's 24% in this county, and most survivors of those are women and Hispanics in this county. And the fact that immigration compounds the problem of intimate partner abuse and violence, because immigration has its own problem. And if you're an immigrant, you understand what I'm talking about, because you come with a different culture and you come to a new culture. You have to go through acculturation, and trying to go through acculturation is problematic. And then if you have a spouse that does not understand all of that and want to stick to the culture you're coming from, and sometimes it doesn't gel with the culture you are in, then it becomes problem. And if there is no patience between the two people, then it leads to abuse and violence. And so we looked at existing tools. Are there tools that are culturally sensitive enough to capture these situations we're talking about? Because I'm a mental health nurse practitioner, and we see some of these in practice as a practitioner. And they come with all these problems they have been to counselors, they have been to different healthcare professionals, But in some cases, it's really difficult for the healthcare professionals or the counselors to understand their perspective because they don't understand that culture as such, because they haven't lived the culture they are living in. So we looked at, are there any culturally sensitive tools that we can use to predict anyone who would be open or who would be predisposed to abuse or violence, so we can catch it before it gets to the point of homicide? Because even within the African community, there's a lot of homicide relative to IPV. People just kill themselves off because they have no other way out. So we want to be able to catch it in the beginning. And that's the purpose of this project, to design a tool that can measure that, so we can see when they cross that line and say, hey, this is getting too high. We need to do something about this. So the existing tools and literature, some of them lack specificity, and some of them are just not geared towards immigrants as such. And those that are geared towards immigrants, they're too lengthy to be used in a clinical setting, or they're too narrow in scope. So those are some of the reasons why I chose to do this. So there's a need for tools addressing culturally and regionally specific factors in New Mexico. And some of the things that really make it peculiar in New Mexico is because we have quite a number of undocumented people, and we also have limited English proficiency. And the economic hardship and fear of deportation is very high. So even when people have problems, you know what they do? They just hide. They don't want to see a professional, because if they go, their undocumented status are exposed. And not only that, they also have problems with how to communicate because they can't speak that good English. So some of the things we face. So the objectives of this project are four. One is to complete a comprehensive assessment of IPV risk factors among the Latino immigrant community. And the second one is to use the key factors now to design, from the assessment of a phenomenological approach, to design the tool that we're going to use to measure IPV factors. And then we pilot test the tool once we design it. The theoretical framework behind this is social ecological model, which we are thinking of in terms of the effect on the society, on the individual, and on the families. And then the acculturation theory, which determines how easily they will get accultured to the new environment they're coming in. And the theory of planned behavior, because that's what determines what their behaviors are going to be, whether they are actually going to hit each other, or they are going to report to the police, or whatever they want to do, or they're just going to keep it to themselves. So those are the three theoretical framework that underlying this. And there are two phases to it. I get to the methodology soon. It's a sequential exploratory design, just like the previous speaker talked about. But you see, when she was talking, I was like, okay, mine is kind of backwards from what she talked about. With this one, we have to identify the factors first. So we're going to use a qualitative methodology to identify those factors. And then we test out the tool once we use it. And that's when we use a quantitative methodology. So the inclusion criteria to be involved in this project is you have to be first-generation Latino immigrants, definitely. You got to be an immigrant to southern New Mexico. You must have lived in New Mexico for at least 1 year. And I'm saying all of this in case you have people that you think you can send my way, because this is not completed yet. You must have lived in New Mexico for at least 1 year. And we said at least 1 year because we want you to have that interaction with your new environment. Otherwise, we're just going to be measuring what you came with from your previous country. So we want that interaction for at least 1 year. You must have lived, or you are living with, an intimate partner post-immigration. And then English or Spanish speaking. I think I made a mistake with that because I got mostly Spanish speaking, but that was the goal. So recruitment was going to be a snowball technique, and that's what I've been helping us so far. If you know somebody, like I'm telling you now, if you know somebody, then you tell somebody else, and then we get it through that. We had flyers, posters. I think we made over 1,000 flyers and distributed around the whole. We went to New Las Cruces, Chaparral, Anthony, Mesquite, all over. Um, then public meetings, we've attended public meetings and gatherings and introduced our project there. We even put it on the buses for public transportations. We went to community health workers. We talked in their group. And La Casa Inc., which is the domestic violence shelter, is one of the communities that are working with us to get the subject participants. And then we continue to recruit until data saturation. Now, where we are right now, we've recruited 36 people. I think it's huge that we got 36. We've interviewed 12. So we're still going on. The data collection is still going on as we speak. So, but there are challenges to recruitment. You know, that bot is coming along the way somewhere, right? The first challenge we had is the moment the president was inaugurated, and the problem with immigration, deportation, ICE, everything was shut down. Nobody wanted to listen to us. Nobody wanted the word immigrant, people just like shun us like we have leprosy. So it was really hard to even talk to anyone. People are afraid to speak up because we've gone to some people because their spouse are in the room, though we create a lot of privacy and everything we could do, they still have that fear that even with the privacy, their spouse can hear them on the phone. I don't know why they thought that way. Then we get more participants outside Las Cruces, so we have to travel. That's also a lot of challenge to travel. And there's more Spanish-speaking participants, but we still got 36 recruited and we're still recruiting. The data collection is by personal interviews. So they have to do 2 interviews. The first interview will be to do a personal interviews with a questionnaire. We have the questionnaire design. And the other one is for member check-in. So once they've done that and we did initial data analysis, we send it to them to ensure that this is exactly what they're telling us. So that's member check-in in phenomenology. We ensure privacy and confidentiality, and we follow all ethics guidelines as you will expect. And we compensate them with $25 per meeting. So, that's coming to be expensive, $50 per person. And these are the interview questions. Our interview questions are based on, we want them to first tell us if they think it's a problem, because some of them don't think it's a problem. They think it's just the way of life with Latinos. So it's not the way of life. We want them to identify that. And then we want them to provide to us, because they are the one who live in the community. They know they have friends that are immigrants. Give us a perspective. What is their perspective of the percentage? It's just a rough estimate. We want that. Then we go ahead and dig into factors that they think will be responsible for this intimate partner violence or abuse. And we already went through literature. We've highlighted some of the factors that the literature talked about. So in case they don't give us some of the things we're looking for, we kind of cue them into it and dig deeper to see if they have experienced those. And then, of course, the interview is still ongoing. So our data analysis right now, we just started looking at the data so that we can get to know when we get to saturation as we go on. Initially, we did some bracket preconceptions. We bracket our thoughts and preconceptions in a meeting. We meet every week as a research team, 2 hours every week. And then we will go and reread the transcript once we get all that going, and we extract significant statement, formulate meanings, and develop descriptions and what and the how, and synthesize the essence of it and validate our findings. So we are going to use the qualitative steps highlighted by Cresswell and Port. And for the quantitative, we're going to use expert reviewers. Once we get the tool designed, expert reviewers to look at that. We will recruit participants for the pilot testing. And then we evaluate the validity and reliability of the tool itself through internal consistency, construct, and criterion validity. And then with pilot tests on same population. These are references, and I'm open for questions. Where we are right now is we are still in the process of data collection. So really, I don't have any result to show you. But it's been very tedious. If you work with qualitative research before, you know how easy it is, right? To do that. So it's been very tedious. So I'm open to questions.
I know, the funding for the Emerging Scholars Award started in January, the start of the semester. So all of these researchers have only been working on this for 2-3 months. And so it's really an amazing amount of work that's gone on already. So a lot of progress on all of these projects. Any specific questions? Dr. B?
Yes.
This is simply because I'm not sure about how clinical surveys, but when you say that they're too long, like what kind of what length are you targeting for a clinical survey in this type of situation?
Because clinical surveys are usually used in the clinical settings, and providers don't have the time to go through a lengthy thing. Usually most clinical surveys are from, some are even 5 questions to 15 questions.
Okay.
Max. And some of these lengthy things they're like 40 questions. So there's no way you can use in a clinical setting. You can ask them to complete it before they come, but then you still have to review it to be able to make a sense of it. Yes.
Is E in Spanish, and how are you going to make sure that you're capturing language nuance?
That's a great question. So one of the things that delayed us starting this is that everything had to be translated into Spanish, and we had to have 5 reviewers review the Spanish and the English version to make sure they match. So the same thing we're going to do when we get to that point, we will have expert reviewers to review it once we translate it to Spanish. Definitely, it's not going to be helpful to them if it's not in Spanish, since most of them are Spanish speaking. The same thing with our transcripts. I'm constantly translating from Spanish to English because and one of the issues I have right now is, it's interesting. We did all the work and then I have them call me and I book all the appointment to interview them, even the English speaking. The moment they hear my voice, they are like, I think something just happened. I can't make it. But my research assistant, she is Spanish speaking. She is Latino. And all the ones that said no to me said yes to her. So I'm like, that's okay. Because we took like 4 weeks to train her on how to do qualitative interviewing. So I said, you know how to do it. Go ahead. Just do all of it. So that way, at least we can have some sample to use. So anyway, I digress, but that's it.
Those